A clinical trial will be starting up in our area, and local doctors are looking for volunteers. I found out more.
We are doing a clinical trial on to look for a vaccine that is for treatment or really prevention of C. difficile infection. And it's for individuals who either have received antibiotics within the last year and have been hospitalized, or who are going to have surgery in the next several months to try to prevent them from getting C. difficile infection.
Now, any particular age groups you're looking toward?
Yes, C. diff infection seems to be more common and more severe in people over 50, so we're looking for individuals over 50 years old.
Now, tell us a little bit what C. diff is.
C. diff is an infection of the GI tract, so it causes gastroenteritis or diarrhea. And like MRSA, which is a bacteria that's resistant to other antibiotics, C. diff is a bacteria that's resistant to a lot of antibiotics. And it occurs because people will take antibiotics for some appropriate infection, pneumonia, urinary tract infection, or maybe inappropriate like a viral syndrome. And the antibiotic gets rid of the good bacteria in their GI tract. And it's left with bad bacteria, which is C. diff, which we actually all have, but the good bacteria keeps it under control. The C. diff starts producing a toxin, and that toxin causes diarrhea. And the diarrhea can make people sick, like they start having diarrhea every hour, they become incontinent, they become hospitalized. Generally, on an annual basis, about 300,000 people will be hospitalized with this infection in the United States, and about 10,000 will die from C. diff.
Wow, that's a lot of people. Now, talking about C. diff itself, there are some treatments now, but they're not the most glamorous kind of thing, are they?
Right. Well, some are standard, so it's an infection, so it's treated with antibiotics. But the problem is that even with antibiotic therapy, if you're treated successfully, the chance of it coming back is about 25%. And if it comes back one time, the chance of it coming back another time is about 50%. So antibiotics don't do very well with this. Plus, antibiotics cause the infection. So we really want to sort of try to find some other way. So they've done some imaginative things. Like they've figured, well, the problem is that individuals who have this infection don't have good bacteria in their colon because it's been destroyed by the antibiotics. So maybe we could give them good bacteria. So they find volunteers who are usually family members, spouses or siblings or children who will donate a stool specimen, and they have the stool specimen put into the colon by a colonoscopy, which is a standard procedure, and that replaces the bad bacteria, which is the C. diff, with good bacteria, and surprisingly, it worked really well.
But ideally, of course, it would be nice to not have this C. diff. And the great thing about this study is that you kind of get doctor's appointments for free, and this vaccine for free.
That's exactly right. So this study is sponsored by Sanofi Pasteur, which is an international company that makes vaccines like flu vaccine, pneumococcal vaccine, all the ones we're used to. So this is a well-established company. And in exchange for participating in the study, you are given the vaccine for free. It's 2 separate shots. Any doctor's visit, of which there'll be 2 or 3, and any lab work that's done is all done for free by the study. And the only thing we really are asking the patients besides to receive the vaccine is that we will then follow them for 2 to 3 years after they get the vaccine just by phone to see whether they have any evidence of having the infection.
And this, too, is, of course, a good reminder when we talk about C. diff itself, not to take antibiotics unless you need them.
That's exactly right. So the problem that we're having with resistant bacteria like MRSA, like C. diff, is that we're using too many antibiotics. Doctors are prescribing too many, patients are asking for too many, and because of that, we're dealing with these problems that really are getting out of control.
And if you're interested in becoming a part of this clinical trial, you can give Infectious Diseases, a division of Medical Associates, a call at 434-947-3944, extension 2135. And online, you can find more information at centralvamd.com.